It's July 6, Ukraine Media Center Ukrinform continues its operation. My name is Vasily Samokhvalov, and now we will be talking about the psychological and psychiatric aid, specifically about the presentation of the dashboard, the healthcare providers. In these areas, we will be talking with Iryna Mykychak, Coordinating Director for Central Executive Authorities at the Mental Health Coordination Center with the Cabinet of Ministers of Ukraine, and Alisa Ladyk-Bryzgalova, Mental Health Program Lead at the WHO Country Office in Ukraine. We also expect Nataliya Husak, Head of the National Health Service of Ukraine, to join us. Unfortunately, she's having an important meeting now, but we hope she will join us sometime. So we will be talking about this dashboard. I think that we will proceed to our speakers right away. So let's start probably with Miss Iryna. What is it? Why is it we know about the urgency of the problem? We've heard about some horrible or impressive figures that maybe 10 million of Ukrainians will one way or another require psychological aid. So can you please tell us a little bit more about this product? So what are the problems and challenges it will cope with? Thank you for the invitation. It's a good opportunity to share what we're working on and of what use is it for our people. Yes, everybody knows the figures of the studies by the World Bank and WHO and Ukrainian consulting companies about the impact of the armed aggression on the health of Ukrainians, specifically on their mental health. But we would like to talk not so much about the burden of the losses and pressure on our health, but we would rather want to talk about how we can help the people. And most important is to understand and to be convinced that no single enemy cannot destroy us, our country. And in fact, we are a very resilient people. We have the most powerful armed forces of Ukraine, and the specifics of our nation, their resilience and other features that help us cope with those challenges, and the system altogether transforms them into new capabilities. The people need aid, they need consulting, they need advice, but we want them to have understanding that you can help and you should help yourself, and this is the fundamental we base our work upon. No single country in the world, and us included, will never have one psychiatrist per one person or per one building, per one apartment block, or even per 10,000 people. But knowing the fundamentals, the main techniques, the main approaches, we can be able to help ourselves, help our close ones, and minimize the impact on the psychological health of a person. So we support this program, this initiative of the wife of the president. We work in coordination with government agencies and the ministries to make sure that the policies of the ministries are all containing this component of the mental health of the Ukrainians. And the most illustrative is the work of the National Health Service of Ukraine and the Ministry of Healthcare of Ukraine in coordination with the WHO and with the support of our coordination center. So what is the example? Every ministry has their flagman, so to say, project, how to deliver support to preserve the mental health of our people. And the project of the Ministry of Health that was mentioned is related to the integration of the mental health care, psychosocial support into the overall system of the health care. And half of the programs of the state guarantees, they have this component of psychological support. So we, in coordination with WHO and the Healthcare Service of Ukraine, we created a package of support for the adults and children with mental health issues. It allows additional financing of the family doctors, pediatrists, and nurses who work with the basic medical aid. This psychological first aid can be provided to people only in case the medical specialist wields specific knowledge and skills. And with the support of WHO, we organize such training for family doctors. On the course of MHD, I will give the floor to Ms. Alisa, so she gives you more detail about that. But why the basic link? Why the family doctors? I think everybody agrees that today in our society, specifically in the medical crowds, the most trust is to the family doctors, to the specialists of the primary link. They are best understood by the people, and 3 years of pandemics, they provided its positive result for the closest contact with the family doctors, and we enable family doctors to obtain those skills, to get that training that non-specialists in mental health can use to help the people. And now it's already felt that people understand that the mental health psychological support is not psychiatric aid as it was usually interpreted in our society, and we want the people to have understanding that every specialist in the area of the healthcare has the skills, or has to wield the skills of psychological support, and they can help people get this support where and when it is necessary. And based upon this support should be based upon the proved practices and techniques, and in coordination with WHO, Ministry of Health Coordination Center, we work this way of support. And I hope that Ms. Nataliya, the head of National Healthcare Service, will be joining us, and meanwhile I will give the floor to Ms. Alisa. Thank you very much, Ms. Iryna. WHO greets and supports the leadership of Ukraine and the Ministry of Healthcare and National Healthcare Service of Ukraine, which mobilized their efforts under the umbrella of the National Program for Mental Health, initiated by the First Lady. And I want to say that MHGAP history, MHGAP is Mental Health Gap Action Program, is the program to overcome the gaps in mental health, is the global program of the WHO, which was initiated in the world back in 2008. And in Ukraine, we started together with the ministry and the partners, and all the preparation to its implementation was started in 2018. We started with translation of the proven practices. We started training the instructors. We have more than 200 instructors trained already. We adapted certain tools to the context of Ukraine, and generally I want to say that the history of MHGAP in Ukraine is the history of partnership, because we started in partnership with our national partners, the Ministry of Health and the National Healthcare Service, and also the non-government sector and the partners who are involved in reacting to humanitarian crisis, armed conflict and war. Now they got engaged in building those capabilities, because the needs are tremendous in both in terms of training and work. And back in 2013, when we were starting this, MHGAP community had 6 partners. And now, upon the signing of memorandum between the Ministry of Health and WHO, we have 21 partners in this group who work in the area of development, in the area of humanitarian reaction, humanitarian response, non-government Ukrainian and foreign organizations. So thanks to the partnerships, thanks to our joint effort, we've trained within relatively short time, we've trained 3,000 family doctors and nurses, therapists, pediatrists, and in coordination with the partners, with the Academy of National Health Science of Ukraine, we've developed the training based on the MHGAP materials. And within this short period, it's quite an intense result. I mean, in terms of promulgation of this training, it reinforces the capabilities of the basic link to respond to the requests of the patients who address for aid on a daily basis, or not necessarily address with that kind of aid, but they address other problems such as headache, insomnia, or some somatic complaints, and that people not always realize may be a result of stress or anxiety. And the family doctors, in this sense, they are in good situation because they can identify it on early stage so that they can provide some basic aid and support. And in accordance with the recommendations of WHO, the family doctors, who are no specialists in the area of mental health, however, they are specialists in the area of total health, overall health care, they can provide this type of service in an efficient manner. In the area of mental health, they can prevent a lot of things, and they can sort out using that training in case the situation is a bit more complicated. They know whom and when to link that person to for more specialized help, either to social service or to the service that deals with the issues of the gender violence and other social issues. So to summarize it, I would like to stress that in this area, partnership is very important, because Ukraine is a real big country with big population that resides here. This is why partnership is the fundamental thing in this matter. Thank you very much, Miss Natalia. I know that you have a presentation. I know Miss Natalia was supposed to talk about this dashboard, so there is a clicker. Let's decipher this recipe together. So you can go slide by slide and look through it. Alisa has already mentioned about the partnership. It's incredibly important in implementation of this program and in this project, because Alisa personally and me personally and Miss Nataliya Husak, who is about to join us, we are actually the people who are working on creation of this package. And with an extensive support of Viktor Leshko, the Minister of Healthcare, sometimes contrary to the reason, we were able to create this product and to make sure that the specialists of the basic link could obtain those links. The program of state guarantees, this is something that is something that does not require any additional explanation on the 5th year of reform. It's the cardinal change of funding system that allowed the healthcare facilities and autonomous non-commercial utility facilities to get finance for the scope of services provided, not by the number of residents in the area or the number of bunks in the facility. So the main accent in this approach, based on that training of the WHO course, is the orientation to support of the people, orientation to the needs of people, needs of the family, needs of the social people stay in, reside in, the need to create the healthy psychological climate to be able to cope with the problems on their own. So we're not talking about physical problems, but rather the mental needs of a patient. So the state guarantees system, I'm reiterating it, the component of psychological support is present to much extent in the package of the healthcare. I'm talking about palliative health, strokes, heart strokes, multidisciplinary teams, and so on and so forth. And the psychological support with the beginning of the war, starting from the 24th February, became one of the priorities of the program of medical guarantees. And I want to say that during COVID, We were doing a lot to make sure Ukraine turns its face to the psychological support, and not only Ukraine but the whole world. And now in Ukraine we're creating a unique psychosocial service, and our experience is something that we can share with the global medical community, because such experience, such impact on the sphere of the mental health that Ukraine has in the background of COVID, the full-scale war, this is something that the experience that nobody has. And what's acceptable in the global community, that the light forms of the medical or mental health issues are cured outside the hospitals, because this is something new for Ukraine. It's the mental health care issues were cured in Ukraine previously in the hospitals, and the punitive Soviet heritage, this is something that was inherited by Ukraine too. But now when people receive aid in the hospital conditions, I would like to put a chair for Miss Nataliya. Well, the pediatrist therapist, it's a lot way more comfortable, way more, I'll give you a minute for a breather, it's way more accessible. So we walk this way to make sure that the basic link is really basic in terms of psychological support. We have a network of branches of hospitals. They include non-commercial and private healthcare facilities that are capable of providing psychological support. So Nataliya Husak has joined as head of the National Health Service of Ukraine. We've started reviewing your recipe without you, but you can catch up on this beautiful slide. We're trying to sort out what are you presenting today. Good afternoon, dear colleagues. Good afternoon, dear journalists. Good afternoon, dear spectators. I apologize for being late. In reality, the National Health Service of Ukraine, in building of one system or another, is based on a number of principles, but the main principle is to make it user-friendly, accessible, and free for the patient. We also, since the moment of the creation and establishment of the National Health Service of Ukraine, we are an organization that wants to make the information the most public and accessible for the Ukrainians. And I want to focus your attention that today's electronic instrument is not only for Ukrainians who will act as recipients of psychological support, but also for the medical workers and for heads of the facilities, for the heads of the communities, for the whole system that now takes care of the mental health of Ukrainians, for the system that is being built thanks to the initiative and coordination of the First Lady and Coordination Center. And we would like having a number of such constructive conversations with our stakeholders, the family doctors, and thanks to the efforts of the Coordination Center, we've realized that it would be interesting to them to have a comprehensive information about where they can link the patient in terms of necessity, so they see how this service can develop on the level of territories. And I would like to mention that this is the first electronic tool of the National Health Service of Ukraine, built on the map not only of regions and districts but on the level of communities. It is made so for a reason. The majority of services are human-centric, and we think that the service that we're building on the basic level is a type of service where a person is in the middle, and not only a person but their mental health as well. And using this electronic instrument, we would like to report that the family doctor or other specialists that fulfill the functions of the family doctors. On the level of community, there are no single players, and that on the level of the community, there should be a coordination between all the players who take care about the mental health of Ukrainians. And I would also like to emphasize that on the level of the communities, it was important for us to focus the main management teams of the communities, the people who are directly responsible for the health of people residing in the communities. So talking about the accessibility of the psychological support in the program of the medical guarantees, there are requirements that are in the interest of the patients, and we understand that psychological support always is needed during treatment of different physical diseases. It can be oncology, for example. I was talking to patients recently, and they said that yes, the psychologists really help during the inspection, during the examination, because it contains a synergic element of support to the patients. But we also understand, and Ms. Iryna and Ms. Alisa have told you a lot already, that after people help themselves, the next link that should be also accessible for that person is the basic link. And since the beginning of the last year, from the end of last year, from November, we started contacting with them in coordination center. We were able to talk to the regional teams which are building this service in the regions, and we've seen, for example, that out of 5 contracted facilities in November, thanks to the partners, thanks to the training, thanks to the intense support of Ukrainian-wide program, we have more than 500 contracted facilities. But what's main thing is that for the doctors who believed in their capabilities, the doctors who underwent refresher trainings, they have Ukrainians coming to them who require such help, such support. And now you can see what is the number of such patients who receive this type of aid within the package of the support of Ukrainians, both adults and children who require mental health support. So as to the instrument, the dashboard of the National Health Service of Ukraine is something we take pride in. It's not only public information that anybody can get familiarized with, it's useful information that sometimes saves lives and health. We've come across that issue after the 24th of February, when we had to protect the information in some of our healthcare facilities, and we've seen to what extent people get used to it, because on the dashboard you can find not only the closest doctor, not only the closest medical service, but also the closest pharmacy, working within the program of accessible medicines. And we see that this is something that Ukrainians use, and we can segregate some additional information about the medical healthcare providers in the area of psychiatric and psychological support. This map is represented in the website of the Health Service of Ukraine. You can get the link to it, and is the data from the National Healthcare Service of Ukraine. You can find an analytical panel. You can pick a panel or a settlement to check the type of support that is required for the people, whether it's stationary or mobile, to check the position of a doctor that was trained on the program. You can check their facilities for provision of the healthcare services and to see how close is it to you. I will encourage the owners and the managers of the community and the owners of the healthcare facilities to use this information, because it was probably already said today that the Ukrainian mental health support program has many sectors, and now we have a lot of opportunities from a number of sectors, and in fact we can see where they don't overlap. I mean, the sector of primary medical aid, and where it can be covered by another sector like social sector or the educational sector, to make sure that we build this support in the soonest way possible to make it closer for all Ukrainians. I would like to use this opportunity to thank those medical workers who undertake this challenge existing in our society, because you know that after COVID-19, right away they proceeded to the phase of the full-scale invasion, unfortunately, and the basic link doctors, they are resilient to many challenges, to all of those challenges, and they always think how to develop their professional skills and where they can be of use to the people. This is why I only want to thank once again and focus your attention that the Ukrainians who have not yet picked their pediatrists or family doctors, or if you've seen that due to some reason there is a necessity to pick a new family doctor, because we are the society that was relocated within the last year a lot. So it's important to understand that you can still pick your family doctor. And also I want to emphasize, make another emphasis on the mental health, because it was reiterated many times that mental and physical health are interrelated, and everything related to non-infectional health, I mean cardiovascular, chronic diseases, they are heavily influenced by the permanent stress, permanent challenges. And people need to understand that postponing the problems, any problems related to their health, such postponing will later result in bigger problems with their health. So the entry point, we should understand that the entry point with any health problems is the family doctors, and I encourage everybody to call once again, to make a visit, to undergo necessary examinations within their risk group, within their age group, necessary examinations. The National Healthcare Service pays for all of it, including the psychological help, so please use this opportunity. Thank you very much. So we may proceed to the questions gradually. The question I'm having, we were talking about the need for self-support. Well, it's quite obvious, but can you please tell us, as of today, to what extent the system is ready to the challenges that exist in our society today? For example, how many specialists are existing in thousands in figures, and how many of them do we need? To what extent are we ready to cover those needs? I think that the healthcare system of Ukraine within the last 3 years, or more than 3 years of the pandemic and full-scale invasion, has proven its capabilities to cope with those challenges, possible and impossible, that a couple of years ago we couldn't even imagine. Because I remember clearly the morning of the 24th of February when we were sitting in the cabinet in the office of the minister, and we were talking about the first steps we need to take, and every deputy was thinking, and they said, where's that COVID? We were thinking that is the moment where the system was about to fall, to collapse, but there are things that are more harsh and more terrible than COVID, and the genocide that Russia brought to Ukraine. So there is a lot of problematic issues, just like in every other sector, but in any case, 3 months ago I've left my job with the ministry, and I can look from outside and I can diagnose, comparing with the other healthcare systems that we were able to see during these years, to communicate with the colleagues when they openly share their experience, whether from the United States, Sweden, Poland, or Belgium, where we've been recently. Every system has their problems, but all the colleagues were saying as the same thing: the unique experience that you have in coping with the trauma, the burns, the mind injuries, the physical influence of the war, along with the coping with the problems of the mental health. This is something that no country in the world now has. You coped with it greatly, so we share the international experience that we get. The main expert for us is WHO, but now we have something that we can share, and with something that we can train others in, both in mental health care issues and in organizing support during armed aggression. The number of specialists that we need, well, they're never gonna be sufficient. Okay, but say the perfect, in a perfect world. Yeah, we were visiting the United States recently, and we asked about the number of healthcare workers. They said 600,000, and we were about to break in tears because the number of healthcare specialists in Ukraine is way less. And we understand that the leadership of the First Lady, it brought the attention of the society, the ministries, to this problem, because 1 year ago the officials from the ministries were thinking that it should be addressed by the Ministry of Health, but it's the joint work of different sectors, from economy and employment, service and social protection, army, Ministry of Veterans, the Ministry of Healthcare. It's difficult to say where there is no place where people could get any type of support, or couldn't be forwarded or linked elsewhere. So we work jointly to make sure that the resource that we wield today, and is the recommendation of international experts, to reinforce those institutions that exist in Ukraine today that are efficient and that are functioning. There is a lot of such institutions, actually. You said skeptically about self-support and self-help. No, I'm a great adherent of self-help, but in the area of mental health support, in the area of mental health, self-support is the fundamental where all other work is built upon. This is the WHO pyramid, and I want to give the floor to Alisa. Yes, the self-support is the fundamental of the medical health, of mental health, and it all starts when we start talking about the mental health. It's all about the self-support. So using this opportunity, I want to tell you about two tools that are quite popular all across Ukraine. Maybe some of you have heard about them. First is the initiative, the joint initiative of the Ukrainian Mental Health Program and WHO and many other partners on building of capabilities of stress management in all people of Ukraine. So the management of stress in stressful situations. There is a guide, you can easily access it online. It's called Important Skills During the Stress, that you can use personally as a daily textbook, and it contains very simple exercises. You've heard about maybe mindfulness, breathing techniques and stuff like that, that are easy to master on one hand, but on the other hand they have very powerful scientific base there they are built upon. So the task of the Ukrainian mental health care program is to cover the most people possible. I'm not talking about medical sector, but also about education, social work and all other sectors, to make sure that the most people possible have those skills and can use them efficiently. And among us, we set an ambitious goal to make sure that our target audience, our target coverage with this tool is the whole of Ukraine, the whole of Ukrainian population. It's quite ambitious, but this is something that we're moving towards. It may take more than a year, and Ukrainian program for mental health care, we adapted an important tool. Ms. Iryna has touched upon the topic of COVID. We remember it was an intense stress and unexpected situation for all of us. And there was a useful guide developed, very user-friendly, with very simple exercises and recommendations. It's called Basic Psychosocial Skills for those taking part in response to COVID pandemics. And Ukrainian mental health care program adapted that wonderful guide to the context of war. And it's accessible to everybody online now. So I'm having another question regarding this dashboard or database, in fact. So in continuation to replenishing our resource, the capacity in the social networks, every other person in Ukraine is a psychologist or psychotherapist. So now that those people are numerous, they graduate different institutes, some courses, to what extent they can be added to this database, and how to make sure that there are no specialists of doubtful qualification. They are present in the market, they try to promote their services. How do they go in line with the system that you are presenting now? National Health Service of Ukraine procures services in compliance with certain standard, and in coordination with the experts we formulate the scope of service and requirements to this service, and thus we are ready to procure this service not only from the utility service operators. We procure a lot of medical services from private facilities, but it should be basically in compliance with the standards and requirements formulated by the experts. For example, for the support on the basic level, we were formulating the requirements in coordination with WHO and expert crowds, and we think that those standards are something that make the service of high quality and create its and ensure its accessibility. You can see it from the dashboard. This service is available in many communities, but at the same time the dashboard will always reflect specifically those services and service providers that were procured by the healthcare service of Ukraine. The service that was procured based on their standards. So what's basic in your question, what are the certificates, what are the courses? And I think that there will be a lot of answers to such questions, because what's fundamental for us as the procurer of the medical services is that there are requirements, there are standards formulated by the experts, and this is exclusively how we exercise our procurements. What's worth adding is that this package of assistance to the adults and children with mental health issues on the basic level, the principal requirement is that the nurses and the doctors should undergo the training in MHGAP course that Alisa mentioned. There are 21 providers of such course. It's an offline training, and there is online component. So this online course was underwent by 28,000 our medical workers in from different areas, mostly from the basic link and the Ministry of Health. Within years 22-23 continues to work, and there is a lot of regulations adopted. There is a new profession such as clinical psychologist, for example. It's important for the provision of non-specialized medical aid in healthcare facilities. We reiterate it once again that psychological support and the aid to the people with mental health issues does not equal psychiatric support, because it's a stigma in our society. If people have some deviations from the standard, it means that they should address psychiatrists, and it means, and it was interpreted this way in a number of years, that those people, they have some mental health problems. So it should become a standard that if you have some deviations in terms of some sleep impairment, anxiety, sudden changes of mood, inadequate behavior in work collective, psycho-emotional exhaustion, which is very inherent in many providers of the mental health care aid, I mean the pedagogical workers, state emergency service, the armed forces. That's another specific area of this type of aid of support, but it should become a standard to use those rules. You remember during vaccination we were talking about the simple rules that help save lives. So those are the rules of self-support, which enable you to reinforce yourself and to relieve the load on the system, relieve the burden for the system, not to create unnecessary flow to the healthcare providers, not create lines under the offices of the psychologists, because there are many things that people help themselves with. It's useful to go to the website of the Ukrainian mental health support or How Are You website. They provide recommendations that are of real help. You can do good things on a daily basis, help each other, and to express that empathy to the people. This is something that works in the society. It's a good recipe of the mental health support. Thank you very much. Let's proceed to the questions from the floor. Good afternoon, Nataliya Molchanova, Ukrinform. I would like to get back to the providers of the basic medical aid. So what is the number of such doctors who underwent this training? Miss Alisa said that it's about 3,000, but I see in your presentation that this number is bigger. So can you please tell us how they are distributed in this map? This psychological aid is being obtained on a primary link from the family doctor or therapist, or in a utility service facility where there is a position of a psychologist. How should people pick? For example, my doctor did not undergo this course, but they work in a private hospital, but there is a psychologist there too. So I just want to understand how people who live not in a big cities as Lviv or Odessa, how can they get this psychological aid if the family doctor already has a number of patients of their own? Well, the first thing regarding the training, the Academy of National Health Service of Ukraine, I'm talking about this academy course because they are parallel processes like offline training in coordination with the partners, and this online training was graduated by more than 26,000 medical workers. And I want to say that there are different categories, including managers, family doctors, the specialists in some narrow areas. They think that MH-gap skills will be required by many medical workers, many doctors, and it also includes nurses. So the contracting requirement for this package was at least 20% of family doctors who are the providers of medical services, and 20% of the nurses. They are supposed to undergo the MH-gap course to graduate and get a certificate, and just like Ms. Iryna mentioned, we check whether that certificate is from our partners or from the Academy of the National Health Service of Ukraine. Then, if the requirement is fulfilled, the providers whom I said they are more than 500, if there is a requirement, according to that requirement. In their majority, it's more than 20%. We observe it already. We observe different providers to train 100% of their personnel, so they're able to provide this type of service, so they get contracted. And I want to emphasize that this is not a unique type of service provided by a family doctor. We communicate with them a lot, and the MHGAP course itself focuses them on having this service integrated into a service of the basic medical aid. It's not something separate, not something segregated. And if we check thoroughly into the requirements of the decree number 504 that regulates the work of the basic link doctors, it was always existing in their basic requirements. We just developed their capability, we developed their competencies now. This is why now we don't focus on some specific offices, specific doctors who should be separate, but we hope that the providers will more and more inclined to train 100% of their personnel and want to get 100% of them contracted. As to the patients, since that service is integrated into the basic link, could your family doctor or therapist or pediatrist help you? If they cannot and you're inclined to receiving that specific type of help and your doctor cannot provide you with this type of aid and they don't see what is the need in their patients, what kind of aid their patients need, as I said, you can pick it on the map of the National Health Service of Ukraine. You can pick a doctor, another doctor, and to re-enter into a declaration with them, and the number of declarations and the limits, they are provided in the website of the National Health Service of Ukraine. But again, I wouldn't like to focus my attention now on the fact that this is something that we have to make assessments based upon, because we only develop our system. Yes, there might be some mistakes, some problems, but it seems to me that those figures that we're seeing now in the system, I mean in terms of diagnosis and the way the medical services are being obtained, I think that we have quite a good pace. We have a lot to work on. We keep communicating it with the communities. We are in contact with the medical services providers, but we need to, a little bit, to get a little bit more patient to see its synergic effect a little bit later. I did not emphasize it today, but our electronic data, the transparency, is a motivating factor, because sometimes it seems to you don't know what it is like to look outside the window, to look at your neighbors. This is a part of motivation, and after this tool is implemented, I think that's the managers of the healthcare facilities who has not yet believed, and when they see what is the number of people requiring this service, how developed this service is, the heads of the communities, they see that something is going wrong, that some people have not yet underwent the training, they still don't have contracts, they will pay attention, they would start paying attention to this. And yes, I want to continue developing this electronic tool, because with time we would be ready to publish the number of Ukrainians in some specific institution who have obtained this service. We will start monitor them, identify them, and we will show how it works. And what's on this map also contains not only basic link, it has other services that Ukrainians may not have been aware about. For example, the mobile teams that we develop in coordination with World Health Organization, and it will help them draw their attention to those specialists. So in response to your specific question, your medical healthcare facility can be contracted for this type of service. If your doctor does not undergo this type of training, it does not necessarily mean that they cannot provide you with this type of service, because in the Decree 504 this service was existing always, and maybe they underwent the relevant training before, but at the same time, if you see that this service is not sufficient to you at the level of your family doctor, you may be able to change the doctor, and the electronic tools will help you. More questions? I would like to give more details, because there was a graph previously that 17 packages out of 42 should contain a psychologist. It means that there is no healthcare facility in Ukraine that has a contract with the National Health Service, but today there is a lot of primary healthcare facilities that have financial capabilities and other capabilities, and they deem it necessary and useful to invite a psychologist to work with them. It's absolutely normal, because when we can invite those specialists, we do so. That's another additional option for such support, and the coordination between the providers, I mean the hospitals and the ambulatories of the family doctors, they invite social workers and psychologists as partners, and the Ministry of Education provided us with this information. About 10,000 psychologists graduate on an annual basis in Ukraine, and we encourage all the healthcare facilities to invite them. These people exist, they are being trained somewhere, they're being educated somewhere, so please invite them. And we continue working on that with the Ministry of Education, Ministry of Health, to make sure that the component of the mental health is a necessary training component in the training program, starting from schools and all the way to the higher education, to make sure that the majority of the specialists who obtain such education, they have these skills of stress management, self-help, and more profound specialized knowledge in the sphere of the medicine, which would allow us to become a prominent country, a leading country. And in terms of age gap, there is no single country in the world that were with a number of specialists who underwent this training. Well, let's listen to more questions from the floor. Thank you very much. My name is Mikhail Potocki. I'm from Poland. I would like to ask whether there are state programs aimed at the support of the victims of the sexual violence exercised by the occupiers. Well, using this opportunity, I want to thank Poland. We are in close contact with the Ministry of Health of Poland, and our colleagues underwent training within the last 2 to 3 months in cooperation with the First Lady of Ukraine, Olena Zelenska, and the First Lady of Poland, Agata Konhausen-Duda. We had 50 psychologists and psychiatrists trained and 50 specialists in physical rehabilitation. They've just graduated from the course. Previously there was a course of the emergency healthcare specialist. It's not only training, but it's the opportunity to rehabilitate our specialists. I'm talking about the professional burnout. So state programs on coping with the consequences of sexual violence. There is a huge state program both in our package. There is a training contemplated for the specialists. I mean, they're supposed to obtain knowledge on support of the victims of the sexual violence. We're also in close cooperation with the office of Olga Stefanishin, the Vice Prime Minister. We have also WHO course. The Academy of National Healthcare Service also has the training course in their website, because this is a very important issue now. There is a lot of work, and there is a lot of support, and there is a lot of consulting, of our specialists, so that they have skills to communicate with the people who can potentially, or who could have potentially become the victims of such sexual violence. Yes, this work is very important in Ukraine, and the specialists are constantly trained. Well, if you need a translator, there will be a question in English language. Just a second. just put it in your ear.
Johnson, I'm a journalist from the United States. Do you have any statistics or data about the number of Ukrainians who have sought psychological or psychiatric help since the invasion? How much has it increased? Thank you.
Well, I can tell you only in part of the medical aid within the program of the medical guarantees. We don't only have these statistics, but it's also published by packages, by regions. Let's put it so there are two basic packages, so stationary aid, the mobile teams, and now we have information about the aid within the package of the mental health support of adults and children. So talking about this part, this statistics is existent. It's posted in the website of the National Healthcare Service by facilities, by regions, and this information can be seen by any interested person. Well, can you please give us the specific figure, because the journalist was asking about the specific figure. I'm not ready to give you the exact figure right now, but talking about the support of the adults and children with mental health care issues, all the data is in this graph. You see the Dnipropetrovsk and Poltava regions have the biggest number, along with the Lviv region, because there are a lot of internally displaced persons, a lot of internally displaced individuals. But Ms. Iryna can tell you, this graph does not cover all the information about all the people who were addressing for such support. So talking about the psychiatric health, both outpatient and stationary, it's with the Institute of Psychiatry. They work in this area. As to psychiatric support is not only provided in the psychiatric healthcare facilities, but also by the psychologists, by the school psychologists, Ukrainian emergency service psychologists. They can provide you such information upon request. And obviously the number has grown during the full-scale invasion. That's clear. The managers of the healthcare facilities keep reiterating it, and it's no surprise that in the new project of the World Bank, one of the components of this project of preservation of the sustainable healthcare system of Ukraine, a 5-year long project, there is a component of mental health, and it includes the reform of specialized psychiatric support based on deinstitutionalization and ensuring of patients' rights. So if there are no more questions on the floor, let us wrap up. Thank you very much, Ms. Nataliya, for visiting us, for joining us. We were talking about a very important topic, mental health of Ukrainians, and how we will sort it out after the victory. See you tomorrow. Thank you.